Are you clapping because we're finally starting? We waited for some families stuck in traffic, so thank you for being patient so everyone could be here to celebrate these students. So welcome. This is the white coat ceremony for the Mary Baldwin University PA program, class of 2025. Today we're gathering to celebrate the dedication and perseverance of these truly exceptional students. These 35 new PAs are prepared to strengthen the nation's healthcare system with their integrity and compassion. So I think we're welcoming all the students in now, correct? So please come on in. I'd like to introduce Dr. Todd Telemaco. He's a physical therapist and also our VP Dean of Murphy-Deming College of Health Science.
Well, first, let me just say, I want to welcome everyone, particularly families, friends, supporters. You mean a lot to these folks, and so we're really glad you got a chance to be here with us today. President Stein, Chrissy Stein, ES staff, and Eloise, our Board of Trustee Chair, thank you again for taking the time to be with our students today to celebrate with us. This is a fantastic momentous occasion. It's really rare, so when they're coming in, I'm clapping, I'm so excited because it's really rare when a class gets bigger at graduation, right? But I don't know if you guys noticed, we did get a little bigger at graduation, so congratulations. I want to start off with a little story. I want to talk about the weight of the white coat. There's quite a miracle that happens in nature, a moment of breathtaking transformation inside a cocoon. A caterpillar undergoes what seems like a mysterious and invisible change. For days, there's stillness. But within that stillness, something extraordinary is happening. Cells are rearranging, purpose is forming, a creature designed to crawl is preparing to fly. And then when the time is right, the butterfly breaks through, but it doesn't emerge fully formed, and soaring, it struggles. It pushes. It must fight its way out, not because nature is cruel, but because the struggle itself is necessary. Without it, the butterfly's wings won't be strong enough to carry it away. That moment, emergence, that expansion of the wings, the lift, is what today represents each of you. Because you lived your own version of this transformation. You entered this program full of potential, but still tethered to questions about medicine, about yourselves, about whether you could really do this. And then the cocoon of training began. Long nights of studying, master the intricacies of anatomy and physiology, deciphering lab values, learning to take history, not just with accuracy, but with empathy, art. Then came clinicals with lessons that got real. You stood in patient rooms, sometimes unsure, sometimes overwhelmed, but always committed. You watched experienced providers navigate complexity and grace. You learned the art of healing requires more than just knowledge. It requires presence, humility, and humanity. And now, like the butterfly, you emerge not perfect, but prepared. Not finished, but formed. Not flying yet, but with wings ready to take you there. Today marks a visible shift, the moment you traded a short white coat for the long one. But let me be clear. This is not just a change in your wardrobe. The short coat has been your student uniform, symbolizing curiosity, humility, and the willingness to learn. It's accompanied you through the first patient encounter, your first mistake, and your first breakthrough. It's absorbed your questions, your sweat, and just maybe a few tears. The long white coat, however, carries a different kind of weight. It's a symbol of trust. It means patients will now call you their provider. It means that families will look to you for answers and sometimes for hope. It means your voice will matter in the exam room, in the emergency department, in the operating suite, and that your compassion will matter even more. The code is not a trophy. It is a promise to serve, a promise to care, a promise to never forget that every diagnosis is a person, behind every symptom is a story, and behind every patient is a life entrusted to your hands. So wear it with integrity. Fill its sleeves with knowledge, its pockets with humility, and its shoulders with strength. Let your presence bring comfort. Let your care bring dignity. Let your calling bring healing. The coat may be long, but your heart that gives it is what gives it weight. Congratulations, clinicians. The world needs you now more than ever. Congratulations. Yes.
Thank you, Dr. Telemaco. So I'd like to introduce the faculty for your friends and family and supporters here. So first, Dr. Benjamin Farley, please stand up for us. You can remain standing so we can all clap for everyone. Dr. Farley is our medical director. Ms. Jennifer Hunt, our director of academic education. Ms. Megan Adey, our director of clinical education. Ms. Chesney Carroll, one of our faculty. Dr. Felicia Esteban, faculty. And Ms. Caitlin Powers, one of our faculty as well. Thank you all. And I'm Emily Green. I'm a PA, and I'm currently the interim program director, but these students think of me predominantly as your pharmacology teacher, I think. The person they think of truly as their program director graciously agreed to come be the speaker today. So it's my honor to introduce Dr. Kent Diduck. Not only did Dr. Diduck teach me in my PA program a few years ago, but he also led the MBU PA program as program director from 2020 until 2024. And you guys might remember that something happened in those years, a global pandemic. And Dr. Diduck led us flawlessly through the pandemic. In fact, just to keep bragging about you, we had no delay in education for any students during those trying times in healthcare and in education. And so, though he's trained as a family medicine physician, Dr. Diduck is truly the most steadfast champion of physician assistants that I know. You cannot escape his exacting standards for evidence-based medicine or his kind support, and we are all the better for it. So thank you for being here to speak.
Don't know where I got this, but it's good for water. Let me begin with an official thank you for the invitation to speak today to President Stein, the Board of Trustees who are present today. Thanks for being so supportive of the best PA program in the state. To the Murphy-Deming administration and Dr. Telemaco, great words this morning, and to the faculty who are so incredible and awesome. and to the administrative staff, and I know that we all remember and honor Donna Bletz today. Okay. But straight to the heart, straight to the heart. She just retired. But to my beloved class of 2025, when I gave you the name The Phoenix 2.5 years ago, I did not realize how much you would live into it. You have risen into the sky and shine brightly, and everyone gathered here sees how bright you shine, and they celebrate with you. When I received the invitation, I was incredibly humbled at the opportunity to come back, and humbled. And I started jotting down thoughts. And then I went to the community theater, and during intermission, jotted down thoughts. And then during Sunday sermons, jotted down thoughts. Don't rat me out to the preacher. And then at the retirement ceremony for my neighbor, jotted down thoughts. And then kept a notepad by my bed. So it was very daunting to say I'm going to speak at a ceremony, but then I remembered last year's ceremony speaker. Last year's white coat ceremony speaker was Rob Kyler, a dear friend of mine, and he is also an excellent physician and a very wise man. And Rob wisely said, his first thing he said as a part of his speech was, I don't remember anything anybody ever said at a white coat ceremony that I went to. All the graduation ceremonies, it's about the coming together of the community of friends and family, the community of faculty, the community of administration that came together to create and work with you to help you become the awesome healthcare professionals that you are. So that was one of those, aw, kind of moments, that today's talk is not about me, the ceremony is about you. So that took the pressure off, and that meant I could say whatever I darn well please, and I've been wanting to say all along. The students, graduates, colleagues, are soon going to probably tell you that they already know what I'm going to say. They've probably got bingo cards going already. They probably expect me to say things like, your job is not to be right, your job is not to be wrong. And that in medicine, you've got to keep that balance. They're going to say that when it all boils down, when you're figuring out a problem, it comes down to function, function, function. And then finally, don't forget to be awesome. Well, I'm going to modify that last one a little bit today because I think that's the cornerstone of my talk today. I want to modify don't forget to be awesome to don't forget to be humble. Because a career in medicine is humbling. Humbling in a awe kind of way, and sometimes in a not so awe kind of way. And I want to lean in on that. I want to take you guys back 29 months. 29 months ago, there was a January day, and we had our extensive and comprehensive orientation. One day, okay? And at lunch that day, we sat down and we had a table talk. And we broke you into small groups with your faculty, and I asked you 3 questions, and we explored those 3 questions. The first, what does it mean to be a healthcare professional? The second, how is a PA professional education different from an undergraduate education? And what is the purpose of all the quizzes and tests and assessments that you're going to go through as a part of that professional education? Well, it's 29 months later. There's been a lot of hard work, a lot of laughs, and a lot of tears. A lot of tears. A lot of hard work that probably your family thinks is beyond the realm of the Geneva Convention. I wonder if your answers changed today compared to 29 months ago of what it means to be a professional and what is a professional education. So I want to explore that a little bit because these people may not understand entirely what you've been through. So what is the purpose of quizzes and tests and assessments in a medical education, in a PA education? It is not to show sufficiency. You got an 86 on the test. Good job. What about the 14%? What was it that you didn't understand? What was it that didn't sort of connect for you? What what part of that do you need to work on? I'm glad you got 86, and I'm really, really glad that you got 86, but what about the 14? Because your patients are going to need for you to know when is it the 86 and when is it the 14. Our patients expect us to have that self-reflectiveness. You've heard me call it the spidey sense. We need our spidey sense in medicine to know when we don't know. It is essential to provide good care. And the purpose of all those tests and all those assessments was not to show how awesome you are, because we knew you were awesome, that's why we let you in the program. But it was to start to build that self-reflective skill. And it is hard to not just celebrate the 86, but to say, what is it about the 14 that I need to work on? And that is what it means to be called to a life of being a professional, as being compared to saying, I got my degree, now let's go. Now, what does it mean to be a professional then? Okay? It means I know that you came to PA school because you wanted to drive around in a brand new Ford Bronco with a removable hardtop. Okay? That was one of the students kept saying that in school. Did you seek this degree for a lifestyle, or did you seek this degree for a life of service? I think I know why. I'm going to boil it down, and they've heard this more times than they care to remember. To be in healthcare, it's about confident vulnerability and vulnerable confidence. That balance and that dyad. So for you, I'll help fill you in what that means, and I'll remind them what that means. Confident vulnerability means you're always not going to know something. You're always going to hit that limit, that 14%. And to be able to know when you're hitting it is a cornerstone. We've talked about that. Confident vulnerability is what your patients expect. It's what you need. It's that spidey sense. It's what we've nurtured in you in your degree and getting to this moment. That never ends. A medical education begins, but it never ends. And knowing that it never ends calls you to continue to grow and to continue to see when you hit that. Every time that I put on a new white coat and a change in my career, from private practice to academic medicine to sports medicine to PA program now to internal medicine, I have had imposter syndrome each step of the way, and I have felt incredibly incompetent and incapable each step. You will feel that. Know that that's actually a superpower, not a weakness. Don't feel like it's imposter. Feel like that's my spidey sense, and that's my friend, not my enemy. What about the opposite of being confident in your vulnerability? What about being vulnerable in your confidence? Can you take that vulnerability, that sense of I need to know my parameters, and still knock on the door and say, hi, my name's Katie, what's up? Hi, my name's Arthi, it's a pleasure to see you today. Hi, my name is Kelsey, and aren't you lucky to have me as your PA today? I have to tease. Vulnerable confidence still means you're called to the bedside. You're called to engage. You're called to be present. Bring that vulnerability with you, but be present in the moment. You have the skills. You've earned the coat. It's now a chance to serve. The vulnerably confident provider steps into the turmoil of someone's disease and offers a diagnostic and therapeutic hand. And while they're in the middle of that storm, they have to remain balanced and stable themselves. You're going to be taking care of disease, and in situations that patients aren't always in control of, and sometimes you don't feel like you're in control of either. So you have to have resilience, you have to have grit, you have to have wellness. It carries different catchphrases, different seasons, but you have to have that vulnerable confidence. You have to be able to say, I'm here, and I'm humble, and I'm ready to go, okay? With that resilience, that's a part of what we teach you. That is a skill that you need to be taught in school as well. And it's a skill that you need to nurture as you move forward as well in your career. A skill of wellness is just that, learned. To cultivate optimism, to nurture positive emotions, to prioritize emotional self-regulation, to practice generosity and gratitude, to reclaim agency, and to find meaning in medicine. So the third question I had for you that first day is, what is the purpose of a medical education, of a PA education? It is beyond learning knowledge. It is beyond learning skills. It is also learning how to tap into your spidey sense, how to tap into being confident and still engaging, and also finding resilience and strength to balance those as you go forward. Medical education is so much bigger than an undergraduate education where you just learn catch and release. And you learn organic chemistry, and then you move on to biology 202, and then you move on to whatever prereq you had. It's about becoming. It's about transformation. And I'm willing to bet that everybody in this room has seen a major transformation in you over the last 29 months. Some have lost hair. Some may have gained weight or even lost weight. But I know that you're not the same people when you started this program in such a beautiful and wonderful way. When you advise people who say, I want to become a PA just like you, and what's PA school like? I heard something that I'm going to transform for the moment. Your job is not to get through PA school, but to let PA school get through to you. Let it be transformative. Let it become, because you're going to become something else when you wear that white coat. So, let me, now that you've seen my philosophy of what it means to be a medical professional and what they've been through for the last 2.5 years, I have a charge for you. They need your support now more than ever. You've listened to the tears. You've FaceTimed more times than you thought necessary, okay? It's about to get even bigger as they make their next step forward. So this is how we're going to do this, and we'll see how this works. In a second, I'm going to ask you to raise your right hand, and I'm going to say, do you, blah, 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 blah. And then I'll say, do you, again, on the back side of that, and you'll say, we do. So this is a charge for the crowd, the friends and family gathered here today. I have a charge for you. Could you raise your right hands, please? They're better than you guys were in class, okay? I charge you to help support them remember to be vulnerable when they get a little too big for their britches. I charge you to remember to help them be confident when they feel more vulnerable than confident. I charge you to help them tap into their resilience, their grit, their strength, to be able to keep those two in balance when they need it. Do you? For the faculty, I've got a charge for you. Yes. You guys have been incredible professional role models. You have been the beacon that they have seen to get through this. Not just professors, not just teachers, but healthcare professionals. You have been professionals in every class, in every meeting, in every lab, in every student encounter. You guys have been incredible role models. So I need for you to raise your right hands. Do you promise to be supportive and nurturing of these, your new colleagues, when they reach back, when they feel more vulnerable than confident, and want to tap into your wisdom? Do you? Okay. A career in medicine is humbling. Humbling in an awe kind of way, but also in an awe kind of way sometimes, okay? It's awesome when you listen to that inner spidey sense and make the diagnosis that 3 other people have missed. It's awesome when you listen and connect with somebody and get a hug from a patient. It's also humbling in a not so cuddly way when you didn't notice that temperature and missed that it was an infection. Or when you saw that negative test result and it was a false negative or a false positive. And it's also humbling when you have a patient that's difficult or demanding or possibly even verbally abusive. My charge to everyone here, but especially to the graduates and the incredible class of 2025, my beloved Phoenix, be confidently vulnerable, be vulnerably confident, Nurture the resilience to keep these two balanced, and don't forget to be humbly awesome.
Thank you so much. I know those words mean a lot to your faculty and everyone in this room. It's a great reminder. I'd like to ask our class leadership to come forward. Miss Danny Chapdelaine has a few remarks for us. Danny?
I wasn't expecting to have to go after that. You were making me emotional, man. Okay. There's no tissues up here. Come on, people. No, it's good. Wow, okay. So as we've reflected on this huge accomplishment that we have had, I promised I wouldn't cry. We owe a great deal of our success to everybody in this room who've done so much to support us along this way, especially our wonderful faculty and professors, and I think there are some preceptors here today, and mentors as pre-PAs. Thank you so much for your patience with us and your guidance and your belief in our potential. And to our family and friends, your encouragement and understanding is primarily why we're here. Thank you for supporting us and being that foundation that has allowed us to be in our seats today. I'm glad that Dr. D had mentioned the Class of the Phoenix aspect, because that's actually a little bit about what I was going to talk about. So, as you know, a phoenix symbolizes transformation. And in many ways, that is what this program has been for us. We definitely have transformed throughout the last 2.5 years. And I would like to share a poem dedicated to my cohort, and it is titled The Art of Becoming. You did not become this overnight. It took long days and longer nights. When the page would blur and your hands would ache, when the silence asked how much more you could take. Across the street, in real-time grace, you learned to see the human face. You wrote by hand till fingers failed, each H&P a quiet trail. You rose when it mattered. You gave all you could give. You led not for show, but to help others live. Some of you traveled far from home. Some stayed, and some stood miles alone. There were rings and vows and moments missed, late night calls and long distance twists. Some held life in newborn cries. Others held grief in quiet goodbyes. You showed up still. You made your way. That's what it means to choose to stay. With pets beside and voices near, you pressed through challenge, doubt, and fear. And in that fire, your friendships grew, the 35 and the boys too. And now this coat, so crisp and white, is not the start, but earned by fight. It bears the heat of all you've braved, the sparks that shaped the nights you gave. It carries ash and embers both, the marks of pain, the proof of growth. For this is the art, not of knowing it all, but rising again whenever you fall. It's learning to care when you're tired and spent, and remembering exactly why you went. So here's to the class that grew through fire, to quiet grit and deep desire. We are becoming not just a name, but in every act and every flame.
That was great. I too cry often, and I will cry before the day's over. But I did forget the tissues in my pocket, okay? Don't worry, I'm gonna step off stage and grab some before we're done. That was lovely, Danny. Thank you for that. So at this time, we will have our graduates stand and exit for the presentation of their white coats. So while they are exiting, we would like to extend our heartfelt thank you to the Virginia Academy of Physician Assistants for generously providing the white coats for today's ceremony. VAPA, which is our acronym for this organization, is the professional organization representing PAs across the Commonwealth of Virginia. They are dedicated to advancing the PA profession through advocacy, education, and collaboration. VAPA plays a vital role in supporting both practicing PAs and students. For PA students in particular, they offer mentorship, networking opportunities, educational resources, and a strong voice in legislative matters that impact healthcare delivery and PA practice across Virginia. We are grateful to VAPA for their continued commitment to the future of the profession and for helping to mark this important milestone in our students' journey with the gift of their white coats. For those students who will be living and working in Virginia, we encourage them to continue their membership, of course, and by doing so, they will be part of an organization dedicated to advocating the policies that allow PAs to practice at the highest level of their education, training, and experience.
All right. I think so. All right, so prior to our students receiving the long white coat, I'd like to take a moment to further reflect on the significance of this moment. So thank you, Dr. Telemaco, for discussing how important this white coat is to us. The long white coat is a symbol of professional identity, clinical responsibility, and the transition from student to healthcare provider. For physician assistants, it represents a commitment to compassionate, patient-centered care, lifelong learning, and upholding the highest standards of medical practice. As our graduates don the long white coat, they step into their roles as trusted members of the healthcare team, ready to serve with knowledge, integrity, and dedication to their patients and communities. We welcome and encourage a short celebration of applause and cheer for each of our graduates as they receive their coats. Okay. Kat Allen. Landon Alston. Megan Ayler. Madison Becker. Jared Bethel. Caitlin Bosella. Catherine Bridgers. Heather Burris. Alicia Campbell. and Eli. Grace Carlo. Danny Chapdelaine. Brenna Gannon. Serena Good. Kelsey Hayjack. McKenna Husser. Jisoo Jang. Courtney Key. Hannah Kukla. Olivia Martin. Emma McClellan. Kieran McClure. Jacqueline Conlon McGrath. Elizabeth Michaels. Olivia Morrow. Trevor Murray. Brianne Parker. Dara Patel. Arthi Ram. Anna Satterfield. Lauren Smith. Kristen Snow. Casey Tran. Kathy Tran. Caroline Vukisevich. Molly Weiner. Well done. Let's give them a big round of applause.
stay standing. Congratulations, everyone. So inside of your program, you can see the PA professional oath. PAs in the audience, as well as our new graduates, please stand and recite the oath along with me. Ready? I pledge to perform the following duties with honesty and dedication. I will hold as my primary responsibility the health, safety, and welfare and dignity of all human beings. I will uphold the tenets of patient autonomy, beneficence, non-maleficence, and justice. I will recognize and promote the value of diversity. I will treat equally all persons who seek my care. I will hold in confidence the information shared in the course of practicing medicine. I will assess my personal capabilities and limitations, striving always to improve my medical practice. I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine. I will work with other members of the healthcare team to provide compassionate and effective care of patients. I will use my knowledge and experience to contribute to an improved community. I will respect my professional relationship with the physician. I will share and expand knowledge within the profession. These duties are pledged with sincerity and upon my honor. Congratulations.
Thank you all for being here. I get the pleasure of sharing a few interesting facts about the class of 2025 before we begin presenting our class awards. The class of 2025 has been quite busy both in and out of the classroom and clinic over the past 27, 29 months, something like that. Today, we want to highlight just some of these fun facts. The class of 2025 took a lot of tests to get here. I'm sure you've heard about most of them. To give you a little bit of perspective on this, they completed 85 didactic phase exams, 9 clinical phase exams, 2 PACRAT exams, which are basically mock board exams, and too many quizzes to even begin to count. There were 8 full days of standardized patient hands-on examinations, including 318 mock patient interactions with all of our wonderful mock patient volunteers, and 1,820 written SOAP notes submitted in their time with us in the program. About 1,000 of those with me, guys. So. During their hands-on time in the didactic phase of the program, they used approximately 25,000 pairs of gloves, breaking about half of those due to sweaty hands during the practicals. They studied for the Challenge Bowl competitions, answering approximately 4,523 practice questions. And they used so many boxes of tissues that we couldn't keep track of that number either. Outside of the classroom, these students also raised nearly $5,000 for various charitable organizations and class events. And then once they entered into the clinical phase of the program, the class of 2025 saw and cared for a total of 53,581 patients. And to finally put all of their hard work into perspective, these students also logged a total of 67,943 hours of patient care during their time in the clinical phase. Aside from all of that, outside of the classroom, they also invited at least 12 new pets that we're aware of. There were 6 engagements celebrated, 2 marriages, 2 interclass relationships, 2 pregnancies, and 1 new baby along the way. So as you can tell, they've been very busy, and we are so proud of all of the hard work that you have done. Congratulations, guys. And then to start off our awards, I get the pleasure of honoring students who achieved didactic excellence. This award is given to the student who maintained the highest GPA throughout the didactic phase of the program. This class made it extremely difficult as we had 3 students with a 4.0. So to break that tie, because we couldn't have that, we had to calculate the average percent grade by credit, and our top 3 students were separated by only 1.8% overall. I'd like to recognize our 2 students that were runners-up for their incredible work during the didactic phase and their achievement of a 4.0. So please stand to be recognized, Jared Bethel and Lauren Smith. Our Didactic Excellence Award recipient not only achieved the highest overall grades during the didactic phase, but was also a member of our Challenge Bowl team, a peer tutor, and an amazing dog sitter. Please join me in honoring Olivia Martin for her didactic excellence.
Certificate and the badge. I'll keep it for picture and the badge. All right, so now on to awarding the achievements made during the clinical phase of the program. Let me get situated here. So most of you all know about the clinical phase of our program, but just to really bring it back and bring that back to your memory, the clinical phase is a year long, and it consists of 8 6-week rotations. The students rotate through 7 core areas of medicine, including behavioral health, family medicine, emergency medicine, internal medicine, pediatrics, general surgery, and women's health. In addition to those areas, we give the students an opportunity to explore another area that they have a special interest in. So they get to spend 6 weeks in an elective rotation in a field of their choice. So this year, we changed things ever so slightly, and we're going to be highlighting student excellence in each of those categories. So the students that receive these awards scored the highest percentage overall in each of these specialties, where their grade was determined by preceptor evaluations of their clinical performance. They had knowledge-based examinations and presentations that they had to give on those topics. Their patient encounter logging that you just heard, that they just saw all these patients. Their ability to apply billing and coding principles, and various learning modules and assignments. So first off, demonstrating clinical academic excellence in behavioral health, Courtney Key. Demonstrating clinical academic excellence in emergency medicine, Anna Satterfield. Demonstrating clinical academic excellence in internal medicine, Kat Allen. Demonstrating clinical academic excellence in pediatrics, Trevor Murray. Demonstrating clinical academic excellence in surgery, Katie Bridgers. Demonstrating clinical academic excellence in both family medicine and in women's health, Elizabeth Michaels. Demonstrating clinical academic excellence in their area of elective choice, we have a tie. First up, we have Grace Carlo in dermatology. And demonstrating that same excellence in genetics, Brenna Gannon. All right. I love giving out these awards. You guys work so hard. All right. So on to our next award. This next award is for overall clinical excellence. So this recipient was praised throughout the clinical phase of the program by the preceptors who said, this student was eager to learn and receptive to constructive criticism. The student truly bonded with the patient at the bedside, and I am impressed by their ability to complete a patient encounter start to end. They were flawless. This student will be an excellent PA, and I would be proud to call them a member of my team. This year's recipient of the Overall Clinical Excellence Award is Elizabeth Michaels. It is with great joy that I present this next award. This is where the tears might start to come, because we're not talking about grades anymore. The PA Student of the Year. So the PA Student of the Year award is given to a student who exemplifies the traits and qualities of an outstanding physician assistant. Let me share some of the comments that this student received from their preceptors. The student is one of the highest quality individuals I have ever had the pleasure of knowing. This student's merit was recognized and mentioned to me by every member of my team, and I work with a lot of people. The student showed up early every single day, stayed late numerous times to finish up patient care to make sure there were no gaps. The student consistently gave more than 100% on every single shift. From a preceptor's perspective, they did everything perfectly. This student is compassionate and caring. They actively sought out opportunities to learn and improve every single day. They're truly a credit to your institution, and they inspired me to be a better person both in and out of the office. This year's PA Student of the Year award goes to Landon Alston. Our next award is the Linda Seastead Stanford Leadership Award. And this award is given to a student who exhibits excellence in academics, clinical performance, and in service and leadership activities during their time in the program. Again, I'd like to read some comments from the student's preceptors. This student was an absolute joy to have in my office. They were professional and excited to learn every single day. They displayed a work ethic that is unlike other students I have ever had in my years of teaching and precepting. One PA said, "This student truly made an impact on the patients, staff, and collaborating physicians, as well as myself. They pushed me to be a better provider." This student's passion for knowledge is evident and contagious. This student is well prepared for graduation and shows promise as a young PA entering the workforce. This year's recipient of the Linda C. Said Stanford Leadership Award is Jared Bethel. All right, next up is the Outstanding Preceptor Award. So this is an award, we have many preceptors in the audience today, that honors a clinician who consistently goes above and beyond in their role, demonstrating not only exceptional clinical skill, but also a lasting dedication to education and guiding our PA students. This award is presented to the preceptor whose continued excellence in clinical teaching has made a significant and positive influence on our program. Through their unwavering support, professional leadership, and enthusiasm for shaping future PAs. This individual embodies the spirit of our educational mission. In reviewing the student evaluations of this preceptor, I could stand up here and talk for hours, but I won't. Okay, we want to get to the reception and really start to celebrate. But I want to take the time to read this student nomination because I think it sums up this preceptor perfectly. Throughout my rotation, this preceptor demonstrated not only exceptional clinical knowledge and professionalism, but also an inspiring level of compassion towards every patient we encountered. Their ability to balance empathy with evidence-based care set a powerful example of what it means to be a truly great physician. What stood out most was their dedication to teaching. They continuously challenged me to think critically, to dig deeper, and to apply myself beyond what I thought I was capable of. They never settled for surface-level understanding. Instead, they encouraged me to be thoughtful in my reasoning and patient-centered decision-making. Their feedback was always constructive and kind. They pushed me to grow both in confidence and in my competence. Under their guidance, I developed a deeper understanding of the human side of medicine. Their mentorship left a lasting impact on me, and I feel incredibly grateful for the time, energy, and heart they invested into my education. This exemplifies what a preceptor should be, and I cannot think of anyone more deserving of this recognition. The 2025 Preceptor of the Year Award goes to Dr. Nee Hill Theodore.
I am so proud of all of you. I hope you know that. And I get the privilege today of awarding 4 of you with the Pi Alpha Award. So I'm going to call you up and we'll clap. But I just want to say this is the first group I've been with through I consider it 3 years. It's a little less, but I'm going to miss you. And you've been a wonderful class, every one of you. So for Pi Alpha, let's talk about that now. Scholarship, service, leadership. This is the motto of Pi Alpha, the Honor Society for Physician Assistants. The Pi Alpha Honor Society was organized in 2004 by the Association of Physician Assistant Programs for the promotion and recognition of significant academic achievement, leadership, research, community, and professional service, and the encouragement of a high standard of character and conduct amongst PA students and graduates. To be eligible for this prestigious award, students must maintain a minimum of a 3.5 GPA and demonstrate excellence in one or more of the following areas: research, publishing, community and professional services, or leadership activities. We are so proud to recognize 4 graduates from the class of 2025. I will present these awards in alphabetical order. When your name is called, please remain up front for this recognition. Thank you. Jared Bethel. Olivia Martin. Oh, Lauren Smith. And finally, sorry. I'm missing it, so hold on. Carolyn Bokisevich. Wait. In addition to our student inductees, we are also bestowing this prestigious award to one faculty member. To be eligible for this award, a faculty member must have displayed distinguished scholarship as well as leadership and service to the physician assistant program and the profession. Joining this fine group of students is PA Professor Megan Ady.
Only a few more things. As you can see, there's a lot to celebrate and a lot of joy in this room. So now we're going to show the class of 2025 a student video, which I don't think has been previewed by any of your faculty. So I am pretty excited to see what's going to show up on this. So I can't let you out of here without one last pharmacology lesson, and I know you're just dying to hear a pharmacology lesson. But I'd like to review metformin, because I think there's a lot we can learn about this drug for your future clinical practice. Metformin is effective. It lowers the A1C by 2%. So be like metformin. Go out and work really hard for good patient outcomes. It has low side effect profile. So be like metformin and be kind to those around you and to yourself. Don't take toxicity with you where you go. Metformin can be used in conjunction with any other diabetes medication. So be like metformin and work well with all of your colleagues. And lastly, metformin is really affordable. So be accessible and tolerant to all of those you encounter. So we'll see you over at Murphy Deming for our reception and further celebrate this wonderful class. Sorry.
And for our graduates, please don't leave the area. We're going to take a photo outside with the photographer.